Boston College Students for Sexual Health began with a grant from Americans for Informed Democracy and a winter retreat that brought us connections with some powerful and inspiring organizations, as well as a great group of activists from across the country. Shortly after the retreat, a small group of students met twice in one weekend. In that short period of time, we talked for hours and formulated ideas. We named ourselves BC Students for Sexual Health. Our first plan of action was to put a referendum on the ballot for the undergraduate government elections in order to allow the entire student body to voice their opinion on sexual health. The referendum called for Boston College, a Jesuit Catholic university, to improve its sexual health education and resources, including the availability of contraception on campus. We had just 5 days to gather 1,000 signatures, but with a Facebook group sent to all our friends and an email sent to the listservs controlled by our group members, we achieved our goal in less than 24 hours. After ensuring our referendum would be on the ballot, we began the Vote Yes for Health campaign. We created banners to hang across campus, posted flyers, distributed quarter sheets on dorm walks, and collected professors' and student leaders' support. During the campaign, we met for the first time with Vice President Rombalski, who offered us limited support and would later help us meet with consultants to reform health services and enact non-contraceptive related goals. From the petition until Election Day, we had extensive media coverage from the campus newspaper The Heights. We always made sure to be available to them for comment, had allies submit editorials, and wrote our own press releases. On election night, we won. With the highest turnout in years, we won almost 90% of the vote and finally established a clear mandate from the student body in support of sexual health resources on campus. The elections brought us even greater media attention, including an article on uscatholic.org. After the election, we continued brainstorming ideas, trying to balance our ambitious goals with the restrictions of the Catholic administration. Residential Life and other administrative offices organized a panel on Catholicism and sexuality. We followed this up with a lecture and discussion with Professor Donna Freitas, author of Sex and the Soul.
As part of improving the sexual health culture at BC and having an open discussion about these issues, we've really been honored to work with a lot of people in the administration as well as other campus groups to foster dialogue and make improvements on campus. So tonight, Professor Donna Freitas will bring her knowledge and research on student sexuality and spirituality to the conversation at BC.
Professor Freitas brought a realistic viewpoint of college students' experiences and helped expand our discussion to the reality of young people's sexuality. While we held very successful events and were taking small steps toward improving sexual health education, the administration was firmly against having any form of contraception on campus, so we took it into our own hands. Gathering condoms from various sources, thanks to some very generous donations, we spent the last week of classes distributing condoms on public sidewalks around campus. While the Boston College Police initially tried to curb our efforts, we established our legal right to be there and were able to hand out over 3,000 condoms with information about safe sex, STI testing, and a website we designed to help students access information about safe sex in general and at BC. BC Students for Sexual Health began just 6 months ago, and we still have many plans to bring BC students the sexual health resources they want and deserve. We will grow our relationships with supportive professors and administrators. We will expand recruitment of student supporters, volunteers, and members. We will continue the process of improving sexual health education and health services and reaching out to local and national organizations for support. We began as a few Boston College students concerned about sexual health and grew into a campus-wide movement with thousands of supporters. Change at BC is glacial, but we will keep working.